What is diabetic retinopathy? All you need to know about diabetic retinopathy is going to be available for you in this video. This is Dr. Anina Abraham. I'm a retina specialist at Advanced Retina Care, Hyderabad. First of all, what is diabetic retinopathy? This is a condition affecting the eyes in diabetic patients, and it commonly affects the tiny blood vessels inside the eye. If you can see this picture, there are small blood vessels, or microvasculature as you call them, which get affected, and these cause leaks onto the retina, which results in swelling in the central portion of the retina. This is a condition called non-proliferative diabetic retinopathy. This is the first stage of the disease. As the disease progresses, the outer portion of the retina, now this is a picture showing the outer part of the retina as well. So this portion is the outer portion of the retina. And just as much all other quadrants. So what happens is, when the outer portion of the retina does not receive enough blood supply, blood flow to the outer portion slowly starts coming down. So what happens is, new blood vessels start growing all over the outer retina. These are called new vessels, neovascularization elsewhere. And why does this happen? Because the blood flow to the outer retina has come down. Let's take a look at it. This is how these abnormal blood vessels look. This is a stage called proliferative diabetic retinopathy, in which blood vessels are seen growing all over the retina. Now, these are abnormal blood vessels. It's good to have blood vessels, provided you're born with those blood vessels. These blood vessels have come only because it is trying to compensate for lack of blood flow. The dangerous part about this is that they are so fragile that they can break and bleed onto the retina. So this is how it will look. So this is bleeding onto the retina. This is the next stage of diabetic retinopathy. All this comes under PDR, or proliferative diabetic retinopathy. By now, the vision has dropped, and it is already a very advanced stage. If this is also left untreated, or sometimes even without going through this stage, a patient can directly land up in a condition like this. So here what has happened is, the whole retina, the whitish portion which you can see, is all a tractional retinal detachment, which is the last stage of diabetic retinopathy. This requires surgery. But by now, the patient has completely lost vision and is blind. So let's look at the symptoms of diabetic retinopathy. It is important to understand that you can be having diabetic retinopathy without having any symptoms whatsoever. In fact, this is the case most of the time, let's say 90% of the time. Patients come with advanced diabetic retinopathy, and it's so difficult to even convince them to undergo any form of treatment because they say their vision is absolutely normal. Now, if a patient having diabetes starts getting these black floaters in their vision, it means there's already a bleed inside the eye. This means that already there are new vessels inside the retina, which is leading to the complications. So you do not want to wait for this stage. However, if you do see black or red floaters in your vision and you're diabetic, you definitely need a retina checkup immediately. Some patients experience some blurring of vision while they read. It can even be blurring of the central few letters in the vision. So this probably means that the macula is involved. There's macular edema or swelling in the macula, which requires treatment. How is diabetic retinopathy diagnosed? Do not assume that there are machines coming out with which can pick up your diabetic retinopathy just with a picture, because there are many, many cases being missed by this AI generated images and all that. It's always better to go to a retina specialist, get a dilated retina examination with slit lamp indirect ophthalmoscopy. This is called fundoscopy. Get your retina checked, because even a machine can make mistakes, and we don't want to see you in the last stage of diabetic retinopathy. By a proper clinical examination, any stage of diabetic retinopathy can be identified. Further testing like OCT, FFA, and other things may be required if it's already diagnosed as diabetic retinopathy. Now, what really causes diabetic retinopathy? The duration of diabetes, not really the control of diabetes, but control is also equally important. How can this be prevented? You really cannot prevent diabetic retinopathy, but you can slow its progression by tighter control of blood sugar and other systemic factors. Now, what are the treatment options for diabetic retinopathy? Let's look at what is available. Retinal laser is the mainstay of treatment. We do retinal laser to the outer retina in cases of proliferative diabetic retinopathy. Why? So that the blood flow diverts to the healthy retina, and the retina, which is already weak, already ischemic, is burned out by the laser. So this is extremely important. It is also possible to do laser to the leaking microaneurysms and stop macular edema. Now, this is a very simple procedure. It takes about 5 minutes. It does not require any pre-op or post-op care. Eye injections or intravitreal injections can be given for various types, various stages of diabetic retinopathy, depending upon the symptoms, depending upon what you're actually treating. There are different types of injections available which have magically cured diabetic retinopathy. So this is definitely a novel way of treating diabetic retinopathy and must be considered. Retina surgery is required only in cases of recurrent vitreous hemorrhage, or if you feel that the retina is detaching. There's a high risk of detachment if diabetic retinopathy is progressing very fast, or in cases of tractional or combined retinal detachment where the vision is completely gone. Retina surgery can restore vision. Again, do not delay too much because the prognosis goes down. Can diabetic retinopathy lead to blindness? Definitely it can if it is left untreated. However, if treated early, if treated on time, your vision can be saved. Is diabetic retinopathy reversible? Not really. It's once you already develop diabetic retinopathy, it only progresses to the next stage. However, it can become stable at any stage. It depends upon control of systemic factors and whether the eye has been treated correctly and promptly.